I would like to welcome everyone to our webinar today. We're going to be discussing the 5 ways to identify patient care gaps and how that will benefit your small practice. I'd like to introduce myself. My name is Jeremy Schwob. I'm an account manager with Harris Healthcare. As we're moving forward through this, if you have any questions, you are muted on your line. I won't be unmuting any of the lines here, so we're going to do any of the question and answering period at the end. But if you do have a question, make sure you're typing your question into the webinar panel, and we'll do our best to answer them within our Q&A session, like I said, when we get towards the end of this. Today's agenda, we're going to talk about what exactly are patient care gaps. We're going to talk about why this matters to your practice, and we're going to give you 5 reasons why. We're going to talk about how we can identify care gaps in your practice, and as I spoke to before, we're going to answer any questions that you may have as we're moving through this webinar here. So diving right into the deep end here, what exactly are patient care gaps? We know that your time is limited, and many of the factors of running a small practice can contribute to losing track of the needs of certain patients. I mean, this happens in most every practice that we deal with on a daily basis. Requirements for tracking quality metrics have contributed to time periods when you might not see patients who are due to visit your office. You know, we're spread very thin, especially on our front office side and our clinician side. Gaps in time when you haven't seen certain, especially those high priority patients in your panel, can hurt patient care and also hurt the financial outlook of your practice. Because providers may not be aware of these gaps, they don't take action. But what are the benefits of finding these gaps in care in my patient population? And that's really what we want to talk about today. So we're going to talk about our top 5 benefits of identifying patient care gaps. And starting with number 1, it's saving time. Your time is limited and you need to maximize the amount of patients you see. You know, we talked about that a little bit within the slide prior to this, spreading very thin, you know, with a lot of the quality measures that you need to address, a lot of the patient issues that are coming in. You know, there's a lot of limited time that you have within the day. Being able to quickly and easily identify and schedule appointments for the highest priority patients is vital. The ability to schedule more appointments can also contribute additional revenue to your practice's bottom line. Instant access to organized patient data can help in more quickly at confirming a diagnosis or developing an appropriate treatment plan. And as we're moving through this, you know, I want to really tie back to a lot of things we're going to be talking about, especially the time-saving aspect of some of these tips here. Number 2, better patient health care. Understanding when a patient should come into the office for a visit is important. The ability to be proactive in scheduling these appointments can improve care. And I actually included a screenshot within this slide because I wanted to show you a little bit of a snippet of what a population health management program can do for you. And as you can see here, we're just running metrics on a practice that we have up here. You can identify a lot of the gaps in care of people that with these certain conditions that are listed on the left-hand side here, or for example, have a physical due. We show that there are a lot of outliers in these cases, and then we have there's a better way of identifying this and an easier way of identifying this and moving through. And it's something I'm going to show you as we're toward the end of our presentation here. Alerting patients to visit the office at the appropriate timeline can result in early intervention on issues and improved pain management. Also, patients who are more engaged in their care and feel more involved in the process can experience better outcomes that way. Number 3 here, improved health of your overall population. I know this is something that is near and dear to a lot of physicians' hearts here. Making sure each patient has at least one face-to-face appointment with a primary care provider each year is one undeniable way to close that patient care gap. Before the end of the fiscal year, the provider can generate a list of patients who are in need of immunizations, lab tests, or preventive screenings and schedule appointments for those who have not yet been seen this year. Being able to see a high-level look at your entire panel can help you better manage your practice and better manage your patient flow. Per Healthcare IT News, we took a look at a case study. CMS selected one small practice in West Virginia to participate in a 3-year population health management project. Among those goals were to decrease costs, improve the health of the population by 15%, and improve the patient experience by 25%. And the results undeniably were outstanding here. Wellness visits for the overall population were greater than 80%. 82% of the 65 plus aged population had annual wellness exams. Adolescent wellness visits increased by a staggering 146% when following these 3 years. Breast cancer screening increased from 42 to 49%. Cervical cancer screening increased from 32 to 49%. Colorectal cancer screening increased from 34 to 64%, and the number of unfulfilled lab orders dropped dramatically. Another benefit of identifying patient care gaps are faster reimbursements. Using a system to gather and provide quality metrics makes it easier to communicate with third-party reimbursement entities such as CMS or insurance companies. Another benefit, financial growth for your practice. Focusing on quality care and coordinating with other medical providers allows the small independent practice to fully optimize its fee schedule while transitioning to the value-based model. Instead of investing time and resources trying to get paid, the process becomes more automated for your practice. You can also increase revenue by filling your appointment schedule and billing for additional services provided to close care gaps. So what to look for? Prioritize the highest risk patients in your overall population. The CMS Meaningful Measures Initiative identifies the highest priorities for quality measurement and improvement. It involves only assessing those core issues that are the most critical to providing high quality care and improving the individual's outcomes. By improving these highest priority quality metrics can be directly correlated to addressing care gaps in order to enhance the health of the overall population. So we've gone through all these slides. We've talked a lot about how we're able to identify this, what to look for, but how can you actually find these high priority patients and cases? You're going to need a tool to provide instant access to comprehensive data about your entire patient panel to develop an in-depth strategy and to target the right patients. There are tools available that can integrate with your EHR system to provide this information and easily identify patients who need care. So let's take a quick look to identify patient care gaps in action. And what I want to do is actually bring up the system for you. So bringing up our care gap section here, I have a test patient that, or a test company that we're able to access here. And as you can see, the screenshot that I took from or put into the previous slide is listed on the left-hand side here. To identify care gaps for our office and running this tool, you can see an automatic listing of the care gap listed in red here, moving through a couple of our higher end active office and physical do segments here. And if you're thinking about your own company, you can try to start going through and matching up maybe a specialty within your office, or start identifying some things that maybe you can think of as a care gap that for an aged population within your group, something along those lines. So what I want to take a look at here is I'm going to click on our diabetes care gap. So it's a very simple tool to use. And see if I click on this, you can see the care gaps that are listed on the right-hand side. We include lab care gaps if we haven't received something within an allotted time period. You see here at least a hemoglobin listing, 1,046 cases. So if I were to click on that, it's going to bring me over to my next screen and actually start outlining patients that have these care gaps. And as you can see, a couple things that we're able to locate here. We show that there's a care gap for, in these cases, lab, clinical care gaps, and also a vaccination care gap that's associated to this. So you can start identifying patients that you feel are more higher priority, listing may be based on their last visit date, their last physical date, their age. We're able to go through and filter with this. And I know you might be saying to yourself, well, you know, I'm only one person within my office. How am I able to go through and contact each person that's listed on this list? You know, we have 1,046 names that are going to be populated here. Well, this tool actually is outstanding because it's going to allow you the option of automatically contacting your patients via either a text message or a phone call. So if I go up here and I click on New Schedule, the filter name will say Diabetic Care Gaps. And as soon as I save this, it takes us directly over to the tool in which we're able to send out automated text messages and phone calls to our patient population. So you can schedule your start date, the campaign type, either a call or text based on the patient demographic information that's being fed over from the system, how often you'd like to schedule that, and then you can customize the message that you want to send. So in this case, a person would call and say the message is for the specific patient's name. They can call them back at the clinic with the callback number listed here. We can fill our callback number, and then you can actually go through here and schedule those phone calls. So if you think you're going to have more of more luck calling around dinner time, you can schedule those calls to attempt on a Tuesday evening right around dinner. So a very easy way to go through and set this up. You know, obviously, in my experience going through working with my physician's office, I know I receive text messages. It's very easy then to reply to that and gives me that reminder to call back in and for maybe a lab that I had missed or a physical that might be coming up or something that is more specialized to your practice. All right, so we talked a little bit about, showed you the AC Population Health module for the Care Gap module. As we're going to close out this and get into some of the questions you may have, gaps in time when you haven't seen certain especially high priority patients in your panel can hurt patient care and also the financial outlook of your practice. There are major benefits to identifying and resolving gaps in care, including better patient engagement, improved care, financial growth for your practice, and getting hours back in your day. You need to find the right tool that can work with your EHR to easily provide you with this information and allow you to be proactive in scheduling appointments. So if you do have a question, I would like you to write it into the question and answer portion within the webinar main section. If you want some more information about our population health service, you can schedule a consultation with the contact information that we have here. A couple questions are being fed through here. Does your tool handle chronic care patients? Actually, yes, it does. We have a few other modules within our population health solution to handle chronic care management. Also CQMs and a patient view of your population. We're going to be having more webinars on these in the future. So if you want to take a look at some of the communication that's going to be sent over to you over the next few weeks, few months, you can sign in and sign up for some other of the webinars that we're going to be having based on these modules. So Care Gaps is one of the modules that we talked about obviously here. I have a question on the cost of this. So there is a subscription cost of $30 per month per physician to have access to this information. And if you're tying this back over to the financial well-being of your office, you can see the benefit of, 1 or 2 appointments that you're filling in per month will pay for this itself. Another question here, how easy is it to schedule appointments for a patient to come in when there is a gap? Talked about that a little bit. I showed you the example there. In my opinion, it is incredibly easy. Just setting that up, you let the system do the work for you, fielding calls coming back in under the notification side. It is a great benefit in this, especially when we talked about saving time here. Number one, on identifying some of the benefits for care gaps, saving time in this case. You can see how easy the system is to be used within this. I clicked on 3 things going into the system, and you saw all that information coming through. And I don't want it to seem overwhelming. We were using a dummy system there with a lot of patient information out there. You can specialize this. You can filter it to the specific information that you would like to see. While there are a couple more questions that we'll see if they filter in here, I'd be remiss if I didn't mention that we have our upcoming National User Conference coming up November 14th through the 16th in Rhode Island. It's an incredible experience to go through, meet some of the folks with Harris Healthcare, have your questions answered in real time, a lot of fun things available too, and you're able to schedule a lot of time with the people that run these systems every day. Another question that just came through here, is it easy to get started? Absolutely it is. If you could use that contact information on there, reach out. You can either give us a call, send us an email, visit the website here. What we do is if you say you want to move forward with this, we, with a flip of the switch, go through and get you going within your EHR system, and you're able to have this accessed almost instantaneously. All right, I don't see any other questions coming through here, so I do want to thank everyone again for joining today. We will be in touch with further webinars on a couple of the other modules that we have through our population health system. So give you a little bit of back time of your afternoon here, and I hope everyone has a great day and great evening. Thank you.